The gentleman from Georgia is recognized for 5 minutes on his amendment.
Well, thank you, Mr. Chairman. Mr. Chairman, I offer this amendment on behalf of myself and my colleague, Mr. Lawson. Mr. Chairman, this amendment is simple, but very important. It simply says that the Republican health bill will not go into effect unless we can certify that no person will lose his or her health insurance coverage. Mr. Chairman, any effort to reform our healthcare system must consider this basic question. We need to know how many people are going to be pushed out, how many people are going to be left behind. This committee must know these answers before we can act responsibly. We must know in our hearts of hearts that we are truly acting on behalf of the American people. With the information we have today, we cannot honestly say this bill will not do harm to women, the sick, the elderly, and the working class. I am deeply concerned that working people cannot shoulder the Republican plan. There is not a family in this country that has not known sickness or injury. They cannot afford to lose their insurance coverage, and we must be sure that we are not taking it from them. Over the past few years, we have seen millions of Americans gain coverage that was meaningful. It saved lives and gave people hope. Gone were the days when insurance companies could put caps on care. Gone were the days of discrimination because of pre-existing condition. Gone were the days when you could be charged more just for being a woman. Mr. Chairman, we have come too far to sweep away all the good. We cannot and we must not turn back the clock on progress. I urge all of my colleagues to join us and support this basic common sense amendment. And now, Mr. Chairman, I would like to yield time to my friend and colleague, Mr. Lawson.
I thank my distinguished colleague, and I thank him for the earnest in which he has approached his lifelong service to his country and the urgency of which he brings this message forward. Today, as people view what's taking place in this committee, what you're observing is not an actual debate and dialogue, but one side of the aisle checking off a campaign promise and the other side of the aisle attempting to be heard, attempting to make sure that the voices of those people who were protected by the Affordable Care Act are heard as well. Roosevelt observed pretty much what the discipline that has been exerted on the other side of the aisle has been today. You sit in icy silence as the other side pours out the humanitarian concerns that have been impacted and will be impacted if this bill were to become law. Roosevelt observed that you appear frozen in the ice of your indifference towards the people that the Affordable Care Act protects. I know that not to be the case of the members who serve on this committee, but that is what it appears to the general public when appeal after appeal and lack of information, you would sit in silence as we perpetrate a catastrophe upon the American people. As Dorothy Thompson from Manchester, Connecticut poignantly said, I am concerned about what will happen to me and my brother. And the prospect of us losing this coverage, that sounds very much to me like a death panel. And I believe that what Mr. Lewis has put forward in his amendment is what we need to do as a committee. Stop checking the campaign box and come together as a committee and work constructively to truly fix and repair the Affordable Care Act in a way that serves all of our citizens. Thank you, Mr. Lewis.
Thank you, Mr. Lewis. Mr. Larson. Mr. Teaberry?
Mr. Chairman, before I make a point of order, I'd like to tell Mr. Larson about Alice from Ohio. Alice from Ohio calls the Affordable Care Act not affordable. Her medical insurance doubled. She's told me that President Obama promised that people would not have to choose between the quality of care and the basic essentials of life. She said, I think that this system and President Obama have greatly failed me and many Americans in what was promised. Today is not about a campaign promise. It's about Alice, who says, I go to bed at night wondering how I'm going to pay the increase in the medical insurance premiums as well as the increases in the out-of-pocket medical expenses we now face as a family. Mr. Chairman, I make a point of order to the amendment because it's not germane to the amendment in the nature of a substitute. The amendment violates House Rule 16, Clause 7, because it creates an unrelated contingency by requiring CBO to examine the issues of uninsured individuals.
Thank you. Does the gentleman from Georgia offering the amendment wish to speak on the point of order?
My friend, I wish you would reconsider making a point of order on this amendment. It is very, very simple. It is only saying, sir, let's certify. Let's certify. Let's make it plain. Let's make it clear that no one will lose their insurance, lose their health care.
Mr. Lewis, if I may borrow some of your time, I have a tremendous amount of respect for you.
I have respect for you.
And for Mr. Larson as well. But I think that over the last 7 years, there's been a reluctance to understand the incredibly negative impact the Affordable Care Act had on many of our constituents. Some who lost the insurance that they had, that they liked, many who lost the doctors that they had for 30 years, like the cancer survivor I spoke to. People in my district now who can't go to the hospital in the county that they live. They have to travel 60 miles away to get care. So I wish we would have had this discussion 7 years ago.
Well, I'm asking at this time, can we certify that no one will lose their health care, their health insurance?
Will the gentleman yield? I thank Mr. Teaberry because I think, who I have enormous regard for. And I think he cuts to what these hearings really should be about. They should be about the woman that you just spoke about and your concerns. It should also be about Leslie Guthrie from West Hartford in my district, who is a young woman who grew up in West Hartford, and she is a cancer survivor who's been helped immensely by the Affordable Care Act. And let's be straightforward and honest. The Affordable Care Act had many problems with it. And for the last 6 years, you've spent saying that the only thing that you could come up with is repeal, instead of sitting down and working together to strengthen the.
Will the gentleman yield?
Sure.
So we had a hearing on premium increases just last summer, and want to point out that since 2011, when we took control, there have been 200 hearings on the Affordable Care Act and the challenges and problems with the Affordable Care Act. 200 hearings at the United States Congress. I'll yield back.
Yes, there have been 200 hearings, but where has the legislation been to actually propose and correct what's happening in people's lives? And so rather than sit down together and come up with a constructive proposal that's actually going to help, this is what Americans despise about Congress. What they despise about us is that we have this endless, tastes great, less filling argument, and that we don't come up with a solution. And so today, after you get to check off a campaign promise, and we get the opportunity to tell you why it's a bad idea, the American public still wonders with great anxiety what is going to happen to them personally, what's going to happen to their lives. We talk about things in terms of H.R. 5342 and all kinds of inside the Beltway language that nobody understands. What they do understand is what's going on very poignantly in the lives of your constituents and mine. And for God's sake, what they want from us is to step forward and come up with a solution to the problem, not an endless campaign battle that will run on into the next cycle. How about we work together to actually solve the problems our constituents sent us here to do? That's Mr. Lewis's point in terms of wanting to guarantee that nobody loses out in their coverage here.
Mr. Chairman? I give time to Mr. Levin.
I just want to say to the gentleman from Ohio, there's not been a single hearing on this bill.
Will the gentleman yield?
Not a single hearing on some pieces of it, but not on the bill itself and on many, many aspects. And essentially what you've done is to tailor this gathering today in ways that you say will limit our ability to raise issues relating to the substance of this bill. That's really what you're doing. So you're combining the lack of a hearing on this bill itself with a piecemeal approach, which really prevents us, because of your points of order, raising these issues in this committee. And so this amendment, Mr. Lewis, is very clear-cut. And essentially, you don't want to answer it. You don't have any answer as to how many people are going to lose their insurance. You have zero. You don't even say how many would gain. It's stony silence and abstention from the merits of this issue. Thank you.
Gentleman's time has expired. I am prepared to rule the amendment is not germane to the amendment in the nature of substitute because it violates House Rule 16, Clause 7, by creating an unrelated contingency requiring the CBO to examine the issue of uninsured individuals, which is beyond the subject matter of remuneration. The point of order is sustained. The amendment is not in order.
I appeal the ruling of the chair.
Mr. Teaberry? Questions on the motion to table the appeal of the chair's ruling. All those in favor signify by saying aye. Aye. Those opposed, no.
No.
The opinion of the chair, the ayes have it. The motion to table is agreed to.
Roll call.
Recorded vote.
Recorded vote is requested. Clerk will call the roll. Yep.
Mr. Johnson. Aye. Mr. Johnson, aye. Mr. Nunez. Mr. Nunez, aye. Mr. Teaberry. Aye. Mr. Teaberry, aye. Mr. Reichert. Mr. Reichert, aye. Mr. Roscom. Mr. Buchanan. Mr. Buchanan, aye. Mr. Smith of Nebraska. Mr. Smith, aye. Ms. Jenkins. Mr. Paulson. Mr. Paulson, aye. Mr. Marchant. Mr. Marchant, aye. Ms. Black. Ms. Black, aye. Mr. Reed. Mr. Reed, aye. Mr. Kelly. Mr. Kelly, aye. Mr. Renacci. Mr. Renacci, aye. Mr. Meehan. Mr. Meehan, aye. Ms. Nome. Ms. Nome, aye. Mr. Holding. Mr. Holding, aye. Mr. Smith of Missouri. Mr. Smith, aye. Mr. Rice. Mr. Rice, aye. Mr. Schweikert. Mr. Schweikert, aye. Ms. Walorski. Ms. Walorski, aye. Mr. Curbelo. Mr. Curbelo, aye. Mr. Bishop. Mr. Bishop, aye. Mr. Neal.
No.
Mr. Neal, no. Mr. Levin.
No.
Mr. Levin, no. Mr. Lewis.
No.
Mr. Lewis, no. Mr. Doggett.
No.
Mr. Doggett, no. Mr. Thompson.
No.
Mr. Thompson, no. Mr. Larson.
No.
Mr. Larson, no. Mr. Blumenauer. Mr. Blumenauer, no. Mr. Kind.
No.
Mr. Kind, no. Mr. Pascrell. Mr. Pascrell, no. Mr. Crowley. Mr. Crowley, no. Mr. Davis. Mr. Davis, no. Ms. Sanchez. Mr. Higgins. Mr. Higgins, no. Ms. Sewell. Ms. Sewell, no. Ms. Delbaney. Ms. Delbaney, no. Ms. Chu. Ms. Chu, no. Mr. Roscom. Mr. Roscom, yes. Ms. Jenkins. Ms. Sanchez. Chairman Brady.
Aye.
Chairman Brady, aye.
The clerk will report the vote.
23 yeas, 15 nays.
There being 23 ayes and 15 noes, the motion to table is agreed to. Are there